So now we've heard from clinical and public health experts on what are healthcare-associated infections, as well as baseline and progress data, prevention programs, and success stories regarding healthcare-associated infection prevention. So what can you do, and what can we all do to ensure further progress in reducing and preventing healthcare-associated infections? First, for hospitals, we can make patient safety goals a priority of all staff. We can support clinicians and staff working with us to engage patients and families in order to make care safer, and we can learn from and share with others our experiences with making care safer. Next slide, please. For clinicians and other care providers, we can engage with patients and families again to implement practices that foster more patient-centered care. And again, we can learn from and share with others our experiences in making care safer. Next slide, please. For consumers, community, and patient organizations, we can raise public awareness and educate patients, families, and consumers about the importance of safe care. We can develop and provide information tools and resources to help patients, families, and consumers effectively engage with their care-providing team. We can also encourage providers to work in partnership with everyone, patients, families, and consumers, to implement safe practices. Next slide, please. For state and local health departments, we can identify safety and quality champions among state-level entities. We can work with and convene partners, as was already said. We can create state-specific resource guides for patient safety from existing resources. And we can work with state officials to raise the importance of patient safety issues like preventing healthcare-associated infections. Next slide, please. For employers, unions, health plans, and states, we can use market-based incentives to promote improvements in safety and other dimensions of quality and value. We can work with private payers, states, and federal government to align efforts to measure performance on quality and safety so that patients and clinicians have the best possible information and that the burden on hospitals and other providers is minimized. We can share information with employees, members, or beneficiaries so they can engage as active partners in receiving better, safer care. Again, these are offered as very general, suggested, actionable steps, but what we really want to hear is how you and within your unit, within your organization, within your institution, how you are succeeding in preventing healthcare-associated infections. And with that, I turn things back to Dr. Wright for closing the webinar.